Hey everybody, how you doing? I'm Will Martin. I'm a family nurse practitioner. I've worked in emergency medicine for over 30 years as an NP. And it was recently brought to my attention that there's a website called physiciansforpatientprotection.org. And if you're a nurse or if you're an advanced practice provider, you might want to look it up and just look at this website to get an idea what I'm talking about. I just pulled it up for the first time about 15 minutes ago, started looking at it and thought, well, there's some things that we probably should talk about here. There's probably a lot of things we should talk about here. So I have introed you to the website. I want to share it with you on my screen here, and let's just talk about some of it kind of quickly. Down at the bottom, it goes into information for patients and starts right out with educational quality. And I'll just read it quickly. Medicine and nursing are different. Education in one does not translate into expertise in the other. The explosion of online NP schools with near 100% acceptance rates should be contrasted against the rigorous, standardized education of a physician. Now, it's hard to argue with any of that. I think it's all true. Medicine and nursing are different. That's very true. Education in one does not translate into expertise in the other. Again, obviously true. And the explosion of online NP schools is something that I think a lot of us have been critical of over the years. How did it happen? How did we get to a point where when I started my NP training, which was in 1993, there were very few NP schools around. Most of them were certificate programs that were a year or less, and they were hospital-based, and you had to be sponsored by a physician who was primarily responsible for your training. I went to one of the few schools in New York State that was a master's degree nurse practitioner program, and that was at Syracuse University. And again, this was 1993 when I went through that. So where did we get this idea that online NP schools are a good idea? I don't know. I mean, I'm going to take a guess that it's money. And anywhere that money is involved, there's going to be probably some corruption or lack of quality or both. I mean, I think that the tuitions that are being charged by not just the online programs, but just all the programs in general. The tuition is just through the roof. It's crazy what nurses are graduating with, what their indebtedness is. It's just absolutely crazy. Now, it's clear that most of these nursing schools that have NP programs, and primarily the online programs, it's a great revenue stream having all that tuition coming in. And yet, most of the education of nurse practitioner students is not done by that program itself. It's done by preceptors in the community, nurse practitioners that are working a full-time job that have agreed to take a student on and have that student work alongside them for X number of hours. And the number of hours, I'm not even going to commit to how many hours are necessary now to graduate with an NP program because it's changed so much over the years. But I'm hearing somewhere in the range of 500 hours, maybe 800 hours. I don't think it's much more than that. And that's not a lot of hours, let's be honest. So the first point here by this website on educational quality, I think is accurate, that nursing programs, NP programs, don't compare to rigorous, standardized education. And that's a good point. Standardized education. Despite the fact that nursing has tried to create some sort of standards for graduate education, for example, it's still all over the place. I can say that even RN programs, which I think are more competitive to get into than NP programs by far. It used to be that RN programs, you had to take 2 semesters of chemistry with a lab. You had to take 2 semesters of anatomy and physiology with a lab. You had to take biology with a lab. You had to take microbiology with a lab. A lot of those things have been reduced or watered down to the point that they're not nearly as rigorous as they used to be. That's my observation. And a lot of that was because nursing programs, RN programs were originally 3-year diploma programs. That's what I went through. And when they wanted to condense it down into associate degree programs, they had to squeeze it into 2 years. And a lot of that science-based education went out the window. Also, I think a lot of stuff that went out the window were the hours that were spent at the bedside learning the art and the practice of being a nurse, which is a whole separate issue. I mean, I could go off on a tangent on that one too. So, all right. So, educational quality, definitely a big issue. And, there is a Facebook group that I came across recently that's comprised of nurse practitioners that are screaming for change in how nurse practitioners are being educated. And I think it's called Clinical NPs for Change. It's interesting. It's worth a look on Facebook. So we look at this next thing here, lack of transparency. With the alphabet soup of initials on many name tags, it's hard to know who is treating you and what those initials really mean regarding education type and level. We're here to help with the confusion. Now, the point that I want to make here is I think a physician on their name tag, it should say physician. In my hospital, and in a lot of hospitals, physicians have doctor. Now, I know that, if you want to go back 20, 30, 40 years, everyone considered a doctor to be a physician. But for those of us that have achieved doctoral degrees, technically you hold a title. Now, I don't use that title in any way, shape, or form in my practice because I don't want to be accused of confusing anybody. But on the other hand, I have a PhD, I have a DNP, I worked hard to get that. I didn't get it so that I could call myself doctor. But it's almost a slap in the face when you're not at least acknowledged that your doctoral degree is, from an accredited program. But again, that's not the hill to die on. Okay, I want to make that point that if physicians in the hospital want to have doctor on their name tag, that's fine. My name tag, it says NP. That's all it says. I don't go around identifying myself as anything other than that. Although the hospital did, and without my request, when I submitted my diploma after getting my PhD, they added PhD after NP on my signature. So that's there. I appreciate it. It's nice. I think it's nice for other providers and other professionals to know that, yes, I'm a nurse practitioner, but I have a PhD, which probably indicates that, he's got some interest in advancing his education. And I think overall that kind of makes us all look good. Anyway, the alphabet soup, it's not something that is a big deal, but I've seen it. I've seen nurses with all sorts of letters. I have no idea what they mean. So they've got a point with that too, that the alphabet soup thing is an issue. Now, healthcare costs. Tests and referrals cost you more money, but make the hospitals a whole lot of money. Non-physician practitioners order more labs, imaging, and make more referrals than physicians. Seeing an actual physician could save your healthcare dollars. That's debatable, and I think that there's evidence in the literature to go both ways with this. And so you can believe what you want to believe. I practice in a mirror-like fashion with the physicians that I work with. Whatever tests they would order are the tests that I order, plain and simple. And there have been times where I don't necessarily feel that a test is necessary, and yet I'm working with someone who maybe is a little bit more risk averse. And for someone who has a heart rate of 108, for example, who's young and healthy and anxious, that physician may say, hey, maybe you want to get a CT angio and make sure they don't have a PE. On someone who's not hypoxic, doesn't have a history of cancer, hasn't been bedridden, the Wells criteria, all of that has been met. They can perk out, the perk criteria would vote against doing a CT angio. And yet, a physician that I work with mentions it, you darn well better believe I'm going to do it, because I want to be able to go home and sleep at night. And I'm not trying to spend extra dollars either. But the point is that physicians are ordering tests too. And I mean, I work in a level 1 trauma center where I don't see very many people going around trying to save money when it comes to emergency care. I mean, after all, what's the first thing that we think of on any patient presentation? We think of what's the worst thing that could be happening. And that is what we're going to rule out. And then what's the next worst thing that could be happening? We're going to try to rule that out too. And I've told patients many times that, you may leave here without a diagnosis, but what I will not allow is for you to walk out the door with a life-threatening condition. I will make sure you're not having a heart attack or a stroke, that you're not bleeding, that you don't have a broken bone, that you're not having a heart attack, that there isn't some life-threatening condition that we haven't looked for within our ability. And so to say that we are costing more money, I dispute that. I don't think that's necessarily accurate. Let's take a look here. Access to care. Non-physician practitioners do not go to rural areas in any greater numbers than physicians do, yet NPPs, I have a real problem with NPP. I'm not a non-anything. I'll suck up the moniker of APP, Advanced Practice Provider. Okay, that's something that many physician organizations have adopted. I'm okay with that. But NPP, non-physician practitioner, just get rid of that. But NPPs don't go to rural areas any more than physicians do. Rural citizens deserve the same level of health care as everyone else. Okay, it's kind of a weak argument. There are plenty of rural areas in New York State that are served only by PAs and nurse practitioners. It's just a fact. And, there may be one physician in a small town, but there are several satellite PAs and nurse practitioners in the area that are also seeing patients. So I think that argument is kind of weak. And so what it says here is, if you're concerned about your health care, confused about the credentials of your healthcare practitioner, or want to tell us about medical management you've experienced with an NPP, blow them in. Email us and let us know. I don't know. I think that's kind of weak and unprofessional. Any of us that have worked in healthcare, regardless of what you do in healthcare, have seen physicians screw up, PAs, nurse practitioners, nurses, EMTs, everyone. Everyone, unfortunately, is human and makes mistakes. So I think that's kind of a weak argument too. But going back to the first thing here, educational quality, I think that's a problem. I think it's a problem that we all can acknowledge. The quality of NP programs, I believe, has gone downhill. Now, you're always going to have that one student that, regardless of how poor the education is, they're going to come out and be a shining star, because that's just how they are. They're just willing to go the extra mile and fill in those knowledge gaps where necessary, and not practice above their scope, and be willing to ask questions as necessary. And those are the type of APPs that we try to hire. Try to hire people that are inquisitive, that are bright, that are not afraid to ask questions, that don't have an ego. They can park their ego at the door. But that's not the way it is amongst everyone. So I think the educational quality thing is something that I think I've touched on it before in the past. it definitely is the weak link for nurse practitioners right now. Also, just recently, I came across something that indicated that the federal government thinks there might be an oversupply of nurse practitioners. I want to get that article and talk about that in another video, but that would be very interesting that for the first time, at least in my career, that someone is saying that we have an oversupply of nurse practitioners. Do you find that to be true in your area? If you do, leave a comment. Or if you think that there's a shortage of nurse practitioners, leave a comment below and let me know that too. Anyway, I wanted to bring this up. I think you should go on this website. I'm going to go on it. I'm going to look at it more deeply. I'm sure that there's a lot more unprofessional nastiness inside here. Listen, I'll just say this. When I first started practicing as an NP, I was young, and my outlook on things was very different than it is now. I didn't know what I didn't know, but I had worked as a paramedic for several years before becoming an NP, and I had a lot of street experience. And again, that translates into, thinking you know everything when, in fact, you have no idea what you don't know. As time goes on, you start to realize what you don't know, and then it becomes a pretty darn scary proposition. And that's where I'm at right now, having practiced for 30 years, and I can still go into work on any given day and likely will see something, come across something that I've never seen before, have no idea what it is, and that scares the heck out of you, and that is humbling. And I will say that our residents, oftentimes a lot of our residents will finish their program and stay with us and work as attendings for a little while before they eventually move on somewhere else. And I'm always impressed that you'll take these students. Now, I have taught first-year medical students. There's a longitudinal course that we offer in our medical school. And I have taught first-year med students. And, I mean, they don't know how to pronounce anything, They are just so green. They're super smart, but they know nothing about healthcare or medicine. And to take that same person, put them through 4 years of med school, which, they load them up with a lot of science knowledge. But then you go through, let's say, a 3-year emergency medicine residency, and you come out and you know a lot of stuff. And it does amaze me because I know their education. I know what they're doing every day. They come out and they know a lot of stuff. I mean, I come across something that maybe I've seen once or maybe twice in my 30 years of practice. And oftentimes they know what it is, and they've probably seen it. And I'm like, you've seen that in 3 years? It took me 30 years to see this and to recognize it. Very humbling. But the point is, we work well together as a team. There's not a day goes by that I don't have a question about something. And occasionally there's a time where they have a question for me. And I have a little subspecialty for wound care and hyperbaric medicine. And so if anything ever comes in that is somewhere within that realm of, chronic wounds, pressure ulcers, diabetic ulcers, carbon monoxide poisoning, things like that, they're going to come to me first because I'm going to be able to give them some legit advice. But it's working as a team. So I know there's a lot of PAs, nurse practitioners, that want to work completely independently. They were told by their program, hey, you are road ready, you're good to go as soon as you graduate. We all know that that's not true. Graduation from a program does not equate to competency. You are a novice practitioner when you graduate. And you're probably a novice for a very, very, very long time because you don't have that standardized medical education that is given to physicians. Could that same education be given to PAs and nurse practitioners? Absolutely. And I think a significant number could handle it. But I'll part with this. I've run a fellowship program in emergency medicine for nurse practitioners for the last few years. I ended that program this year because I'm moving on to other things. But I would have my fellows sit in on resident lecture every Wednesday, and I would also have them be responsible for the Q bank, the questions that were posed every week, and I would make them go through. And they may start out in July thinking that they're just as knowledgeable as the interns, the first years coming through, but they quickly learn after a few weeks that the knowledge gaps just grow wider and wider and wider. And the whole point of that is not to show my nurse practitioner fellow what they don't know, but rather to appreciate the difference in educational preparation. And it's not their fault. It's just the way that the programs are designed. So anyway, I know this has probably been a little bit long, but this is something that we're going to be talking about more, because I think there needs to be some change in how nurse practitioners are trained. And I think that one of the secrets to that would be to really push for fellowship, postgraduate programs. So, all right. Well, thanks for listening. And again, if you have any insight or comments, please leave it in the comments section below. And I'll see you on the next video. Thanks.